It is our great pleasure to welcome all the esteemed attendees to the first National Congress on Immunology, Health and Nutrition about a retrospective epidemiological and anatomopathological study of colorectal cancer in the eastern of Algeria from 2020 to 2022, co-authorized by Dr. Ramli. Thank you for joining us today as we delve into the critical topic of this increasingly prevalent disease. So with outlining our key steps, our work plan starts with an overview, introduction, the risk factors, pathophysiology, stages, epidemiology, and objective, followed by experimental parts, including materials and methods, retrospective epidemiological study, anatomopathological study, immunohistochemistry techniques, results and discussion, including the epidemiological study results, anatomopathological study results, and discussion. And finally, we have conclusion and perspectives. CRC, also known as bowel cancer or colon cancer, is a malignancy that arises in the colon or rectum. It originates from the growth of abnormal polyps and can progress to the formation of cancerous tumors. Understanding the risk factors associated with colorectal cancer is vital in our efforts to prevent and detect this prevalent disease. Also, better comprehend the underlying causes and implement targeted strategies for prevention and early detection. They are characterized into two main groups: intrinsic, extrinsic, including lifestyle, such as obesity, physical inactivity, cigarette smoking, dietary pattern, and alcohol consumption. And then we have intrinsic, including family and personal medical history and others, like gut microbiota, age, gender, race, socioeconomic factors. Colorectal cancer is characterized by several pathophysiological aspects, like polyp formation, dysregulated cell growth, and DNA mutations, APC, Cras and Graph oncogenes, DNA mismatch, repair deficiency, microsatellite instability that contribute to its development. There are 4 stages in the development of CRC: carcinogenesis, initiation, promotion, progression, and finally heading to the metastasis. Although it is difficult to determine the duration required for each stage, decades will likely be required to form CRC. The TNM classification system is widely used for identifying solid tumors, including CRC. It provides a centralized framework for assessing the extent of the primary tumors, the involvement of nearby lymph nodes, and the presence of distant metastasis. Now it is equally to know the broader impact of it in our country or worldwide. Colorectal cancer, CRC, poses a significant global health challenge, being the 3rd most frequently diagnosed cancer and the 2nd leading cause of cancer-related deaths worldwide. By 2035, the incidence of CRC is projected to more than double, with a particular surge expected in less developed countries. In Algeria, CRC ranks 2nd among cancers, following lung cancer in men, breast cancers in women. This alarming situation prompts us to select CRC as the focus of our study. In the present work, we aim to investigate the diagnostic techniques employed for it in Algeria and assess the accuracy of the retrospective statistical survey from 2020 to 2022, the anatomopathological study protocol used for achieving an exact diagnosis. The study was administered at the Department of Pathological Anatomy of CHU University Constantine, supervised by Dr. Asbel. Practical parts. Based on the admission data of the hospital and all the anatomopathological reports, 60 patients, including 23 females and 37 males with colorectal cancer, were included in this study, with an age range from 27 to 87 years. We had the chance to have their ID, gender, age, primary site, diagnosis, and classification TNM. The specimens obtained from colorectal resection were substantial samples obtained by surgery. These samples were then examined microscopically followed by immunochemistry techniques. Results and discussion. We started with outlining by gender, representing a 62%. The majority. They were representing a higher range with men, 62%, and these findings were aligned with Bakwasi and Smiley in 2019 and Ferrari and all in 2020. By age range, it was the age range of 60 to 80 years old, and these results were aligned with Ferrari and all in 2019 also. We have the same results. Distribution by tumor location. The highest range was Richter represents the highest range with the age rate 28%, followed by the sigmoid 18%. However, another in 2010 shows the sigmoid colon cancer occupies the first place. Distribution by degree of differentiation. The majority of them were identified as well-differentiated adenocarcinomas. These findings were aligned with Hamdouche in 2016. Distribution by classification TNM. The primary tumor, 3, represents the highest range with 84%. Regional lymph nodes, 0, represents 49%. Followed by the distant metastases were unknown, with a percentage of 95% MS. Heading now to the anatomopathological results. In our study, we have chosen to present the macroscopic and microscopic results of 2 cases of CRC, a 52-year-old male, patient 1, and a 56-year-old female, patient 2. The first specimen was a segmental bowel resection with a colocolonic anastomosis and drainage. The second one is a descending colon with the upper rectum, ileal loop, total hysterectomy, which means that the complete removal of the uterus, with bilateral anexectomy, which is like a removal of the ovaries and the fallopian tube on the both sides. Starting with patient number 1, microscopically on the left, is a colonic resection specimen. On the right upon opening, there is a presence of an ulcerated and infiltrating tumor formation of stenosis. In this case, lymph node dissection yields 14 lymph nodes, and of course the resection margins must be cut and placed in separate cassettes. Microscopically, it is identified as T3N0MX based on the TNM staging system. It is a moderately differentiated adenocarcinoma. A tumor infiltrates the serosa, displaying a glandular alpha caribriform architecture filled with necrotic. No vascular emboli are observed, which means that the metastasis didn't reach the blood vessels, which is a good sign. A total of 14 lymph nodes were examined. Moreover, the margins were normal. Patient number 2, microscopically, it is a specimen of 30 centimeters. We noted the presence in the mesentery of the upper part of a poorly defined nodular formation in contact with the colonic wall, with a fleshy whitish appearance. Upon opening the colon, a tumor formation is observed. It appears to be budding, which means that the tumor is active, stenosing or norming, if I have to say, located 4 centimeters from the interior end, adherent to the uterus and completely infiltrating the left ovary and the fallopian tube. Microscopically, it is a T4B NXMX, also a moderately differentiated adenocarcinoma. In this case, a colon adenocarcinoma on the basis of the presence of tubular structure with a branched papillary, like finger-like construction, on the surface. Additionally, the tumor infiltrates the left ovary, the small intestine extending out to the serosa. No vascular emboli are observed, and 1 metastatic lymph node was identified. Immunohistochemistry results, study conducted on the tumor of the left ovary to confirm its colonic origin, revealed negativity for CK7 and its positivity for CK20 and CDX2. CK7 and CK20 are certain types of cytokeratins which are found in the epithelial cells. They're used for identifying and differentiation of certain types of cancer. CDX2 is the primary tumor used for identifying a gastrointestinal origins tumor. Colorectal cancer is a growing cancer in Algeria. The disease is mainly characterized by well-differentiated adenocarcinomas. To identify and classify tumor types accurately, biopsies and histological analyses are conducted, following established standards such as the World Health Organization NCINH staging systems, combining anatomopathological, histological, and molecular methods, enhances accuracy in determining the molecular subtype of CRC, influencing treatment decision. CRC also provides a clinical model for studying preventive vaccination approaches, especially for hereditary forms, offering a promising therapeutic perspectives. Thank you for your attention.